This is the second lecture of Histotechnique, in which we will discuss the most important topic of Histotechnique, that is fixation. So fixation by definition is the process in which a tissue is safeguarded against postmortem changes, that is autolysis and putrefaction. So what is the mechanism of fixation or principle of fixation? As that fixative brings about cross-linking of the protein, which produces denaturation and or coagulation of protein, so that the semi-fluid state is converted into a semi-solid state to facilitate easy manipulation of the tissue. The main aims and objectives of fixation is to preserve the tissue in as lifelike manner as possible. Second is to prevent postmortem changes like autolysis and putrefaction. As we discussed, autolysis is the lysis or dissolution of cells by enzymatic action, probably as a result of rupture of ribosomes. Putrefaction is the breakdown of tissue by bacterial action, often with formation of gas. The third purpose of the fixation is preservation of chemical compounds and microanatomic constituents so that further histochemistry is possible. Hardening is another effect of the fixation, which allow easy manipulation of soft tissue like brain and intestine, etc. Solidification converts the normal semi-solid consistency of cell to an irreversible semi-solid consistency. Fixation also brings about optical differentiation, and it also enhances the effect of. So what we assume should be the properties of an ideal fixative. So the ideal fixative is the one which should be cheap and having market availability. It must be easy to prepare, require less supervision. It must be rapid and having even penetration. It imparts sufficient hardness to the tissue. An ideal fixative must inhibit autolysis and putrefaction effectively. It must give the tissue an optical differentiation. It should not be toxic, irritant, or corrosive. It should not cause shrinkage, swelling, or tissue distortion. It should allow tissue to be stored for longer time, and it should fix the tissue in natural color or life-like manner. It should neither eliminate nor add any material to the tissue. Now we will discuss the classification of fixatives. So the first classification is based on the number of fixatives. For example, we have simple fixative in which one chemical is used for the purpose of fixation, while compound fixatives are those in which two or more than two chemicals are combined and used for the purpose of fixation. So we will discuss these simple fixative one by one. So top of the list is the formaldehyde, which is a routine fixative used in the histopathology laboratory. So formaldehyde is actually gas, but it is soluble in water, and its solubility is 37 to 40% weight by volume. This solution of formaldehyde in water is called formalin or full-strength formalin. So formalin is one of the commonly used fixative in all laboratories, since it is cheap, penetrates rapidly, and doesn't over-harden the tissue. The working solution for formaldehyde is 10%. The main advantages of formalin is it is cheap, it is very easy to prepare, fix the tissue in natural color, it doesn't cause shrinkage or brittleness to the tissue. Frozen section can easily be prepared while using formalin as a fixative. It also enhances staining effect of the tissue. It can be used in compound fixatives, and it is also one of the museum fixatives. So there are also some disadvantages associated with formalin. It is toxic, irritant to skin, cause dermatitis, sinusitis, and asthma. Secondly, the concentrated formalin should never be neutralized as there is a greater danger of explosion. The third one is the commercially available formalin become cloudy and staining, especially when stored in a cool place due to the formation of precipitate of paraformaldehyde. The fourth one is it is time consuming. Time required for fixation at room temperature is 12 hours almost. There are some traces of formic acid which are normally present in commercial formalin, and this can be neutralized by the addition of small quantity of magnesium carbonate or a few drops of sodium hydroxide. And the acidity usually reduces the quality of staining, particularly in nuclear staining. Similarly, in tissue containing much blood, for example spleen, unbuffered formalin leads to formation of dark brown color artifacts called formalin pigment. It consists of acid formaldehyde hematine and are refractile. The second simple fixative is mercuric chloride, which is a metallic salt, and its solubility in water is 7%. It is mainly used as secondary fixative. It belongs to the class of fixative of unknown mechanism. There are some advantages of this mercuric chloride. The first one is the fixatives are mainly used as secondary fixative in order to enhance the final staining after primary fixation in formalin. This acts as a mordant due to metallic mercury, so staining reactions are excellent in routine hematoxylin and eucine staining. These give good staining results also in case of special stains like trichrome stain, which are used for connective tissue elements and muscle fiber differentiation. So there are also some demerits of the using of mercury chloride. The first is these fixative produce a lot of shrinkage in tissue. Fixative containing mercury chloride leaves a precipitate of mercury in tissue, and it must be removed prior to staining. Mercury chloride fixatives are not stable and easily deteriorated. Mercury chloride is corrosive and should not come in contact with the metal surface. It is poisonous and must be handled with care. So picric acid is also one of the simple fixatives. It is yellow in color. Its solubility in water is 1% and it is used as a fixative for histochemical demonstration of glycogen. It is also used for handling tiny biopsies. There are some advantages and disadvantages of the picric acids. So it produces marked cell shrinkage, hence it is not used alone. It has to be stored in damp places because of its explosive nature. It is preferably stored under a layer of water. It penetrates well and fixes tissue rapidly. It precipitates protein and combines with them to form picrate. Some of the picrates are water soluble, so must be treated with alcohol before further processing, where the tissue comes in contact with water. Picric acid also imparts a yellow color to the tissue. Other examples of the simple fixatives are ethyl alcohol, acetone, potassium dichromate, osmium tetroxide, which is an oxidant, and acetic acid. Now we will discuss compound fixatives. Now coming to all the compound fixatives, so some fixatives are made by combining two or more fixatives so that the disadvantages of one are reduced by the use of another fixative. All these compound fixatives have their own advantages and disadvantages. So what should be the choice of fixative? The choice of fixative depends on the tissue. What is the chemical structure that need to be stained? If fat is to be demonstrated, the formalin fixed tissue is better. For demonstration of glycogen, formalin should never be used. Compound fixatives are further classified as microanatomical fixatives, cytological fixatives, and histochemical fixatives. Microanatomical fixatives fixes or preserve the anatomy of the tissue. Cytological fixatives, on the other hand, are used to preserve intracellular structures or inclusions, while the histochemical fixatives are used to preserve the chemical nature of the tissue. So we will discuss some of the microanatomical fixatives. So the first one is formal saline, that is 10%. So 10% formalin and 0.9% sodium chloride, that is normal saline. This has been the routine fixative of choice for many years, but this has now been replaced by buffered formal or formal calcium acetate. Other microanatomical fixatives include neutral buffered formalin, formal calcium, buffered formal sucrose, alcoholic formalin, acetic alcoholic formalin, formalin ammonium bromide, Zenker fluid, and Zenker formol, that is the Helly's fluid. So these are some of the microanatomical fixatives. Next is the cytological fixatives, which is further divided into nuclear fixatives and cytoplasmic fixatives. So nuclear fixative, as the name suggests, it gives good nuclear fixation. This group include Carney's fluid, Clark fluid, and Newcomer's fluid, while the cytoplasmic fixatives include Champy's fluid and formal saline. The third group is histochemical fixatives. So mostly vapor fixatives like vapors of the formaldehyde, acetaldehyde vapors, glutaraldehyde vapors can be used for histochemical fixation of the tissue. There are some special considerations while preparing of the specimen for fixation. For example, for achieving good fixation, it is important that the fixatives penetrate the tissue well. Hence, the tissue section should be 3 to 5 mm thick so that the fixative penetrates from the peripheries to the center of the tissue. For fixation of large organs, perfusion method is used. That is, fixatives is injected through the blood vessels into the organs. For hollow viscera, fixative is injected into the cavity, for example, urinary bladder, eyeball, etc. The ratio of volume of fixative to the specimen should be 1:20. The time necessary for fixation is very important. Routinely, 10% aqueous formalin at room temperature takes 12 hours to fix the tissue. At higher temperatures, that is 60 to 65 degrees centigrade, the time for fixation is reduced to 2 hours. So now we will discuss some factors that affect the fixation. The first one is pH. So generally a pH ranges from 5 to 8 is used for fixation. A specific pH according to the biopsy should be used. For example, the gastric mucosa require a pH of 5.5 while the nuclear fixation required 4.6. The second factor is temperature. So increase in temperature causes rapid fixation. For example, formaldehyde heated at 60 degrees centigrade is used for emergency biopsies, but it can also diffuse molecule. It can also result in autolysis, and in case of inflammable chemicals, there is a risk of fire. So concentration of fixative is another factor that affects the fixation. For example, increased concentration will increase fixation for some and decrease for others. Glutaraldehyde can be used 3% concentration, but it is most effective at 0.25% concentration. Time of fixation is also one of the factors that affect the fixation. Generally, 12 to 24 hours is used for the fixation, but the large size of the biopsy will prolong the time of fixation, and it is also cause the physical changes like shrinkage, swelling, hardness, brittleness, and if oxidizing agents are used, it will result in oxidative cleavage of the protein. Similarly, osmolarity of the fixative is also one of the factors that affect the fixation. For example, hypertonic fixative cause shrinkage, hypotonic cause swelling. Isotonic is the best option, but it is slow in penetration. So normally slight hypertonic fixative should be used for the purpose of fixation. Thank you very much for listening.